Okay.
Hi, everyone. I'm Dr. Funke Afolabi Brown, the founder of Restful Sleep MD, where we help high achieving women like you prioritize sleep so you can live to your fullest potential. I am so excited. I have a friend here, Dr. Akinronbi, who is a psychiatrist and is the founder of BrightMindsMD. And we will be talking about anxiety. And I feel that this is such an important topic because it's at an all-time high. And so really in for a treat today. So good to have you, Dr. Akinronbi. Do you want to tell our audience about who you are, what you do, and all that awesome stuff that is you?
Thanks for inviting me, Dr. Afolabi Brown. Thanks for inviting me here. I'm excited to be here. As you said, I'm a psychiatrist in private practice. I'm also the founder and lead psychiatrist at Bright Minds MD, a private psychiatric practice in New Jersey. And there we focus on helping people who are worried and depressed heal.
That's amazing. People who are worried and depressed heal. God knows we need a lot of that. We need a lot of healing, and we need a lot of healing from the inside out, really. And I wanted you to just have this talk with you, and I was really looking forward to it because I do work with women who tend to be run on the anxious side. But you would never know, right? They're not shaking, they're not having panic attacks. We start to really see them have these issues right around sleep when they wake up in the morning, the mind racing, the feeling of overwhelm, but they're able to cope, right? And so
Right.
why is, and I'm seeing that more and more, it's becoming more and more common. Why is anxiety becoming such a big issue? Or is it that we're just more aware of it? Like, what exactly is going on?
Yes, I was going to say that we're more aware. It doesn't seem like
Mm,
the prevalence of anxiety is any more than it's
mm,
always been. I think overall worldwide wide prevalence of anxiety has been around like 25%. And so far, we
mm,
don't know that it's increased. It
mm,
seems more that we are more aware. COVID forced everyone to a halt. We were all forced to
mm,
sit down and just sit with ourselves.
mm,
Previously, a lot of busy women just coped by running fully on, doing this and that, and many
mm,
things, and that they didn't have to stop to think about themselves.
mm,
During COVID and now, like the post-COVID period, we've all become aware of our feelings.
mm,
We're more in touch. And I think it's become more acceptable to explore our feelings and talk
mm.
about how we are. So more and more people are surfacing and saying, okay, maybe how I've been feeling is not so normal. And maybe it's okay to talk about it. And so more people are talking about it.
That is so powerful because I just was like, wait, why? Like, I would say, what is going on? And it turns out you're very right. It's probably because we were forced to come in terms with ourselves with
Yes.
COVID. And really it's a struggle. Now that you're aware, it's like, what do I do about that? Like I was telling you before we started this show, how I had someone reach out to me and say, I have chest pain. I don't know where that's coming from. And by the time we went through her schedule, she was anxious and she was having a panic attack, really. But she could barely understand where that was
What
coming
it
from. So
was.
especially for women who are, go-getters, who are professionals, who get it done, who are high performing, high achieving, hyper focused, you know, what subtle signs, what are the telltale signs that they might have to let them realize, oh, wow, I might be struggling with anxiety, even if I've sort of coped all this while, this discomfort is probably a symptom of anxiety or the other. So what are some of those?
Things to look out for. Thank you, Dr. Afolabi Brown. So I would say that the vast majority of high performing women don't stop until
Mm,
something starts to impede their ability to function. So like
mm,
many high performing professional women are juggling 10 things at once. And when they start to feel like they're not operating at capacity or they cannot keep up anymore, is typically
mm,
when they start to present for help finally.
mm,
But I would say commonly what we see is disturbed is the sleep a lot. Like,
mm,
so now typically we know that if people are able to sleep at night, they can recover a little bit and continue their day. But
yeah.
oftentimes, if you start to find out that when you lay down to sleep at night, now you're ruminating, your mind is going a mile a minute, you cannot wind down, and you pop up, you look at your clock, it's 1 a.m., it's 3 a.m., that's definitely a sign that things are not right. Some people on the other end wake up, they pop up super early, and they find that they're afraid to face their day. People who were fully functional before suddenly find that they wake up in the morning and they are fearful of facing the day and everything that they have to do. So that's a sign that something is wrong. Some of the subtle signs would be maybe like recurrent headaches, because you're not aware that you've been so tense, like because when people are anxious, they're tense. I was speaking to a dentist even recently on this topic, and people grind their teeth a lot when they're anxious. So like if you start to find out that you're having lots of jaw pain, back muscle tension all day, and not realizing why, it could be a pointer to anxiety. And irritability is another one. I meet moms who are like, suddenly everything my children do, it annoys me. I just cannot take it, and I'm annoyed with my husband all the time. It could be a pointer that there's so much going on in the mind that you're tense and you have no bandwidth for people in your life. Small things just annoying you a lot. I would say those are subtle signs that pop out.
Yeah. Oh man, that is incredible. You know, the interesting thing, every single one of this is a feature of poor sleep, right? So and that's one thing I say, like anxiety, mood disorders, and sleep disorders, it's a bi-directional relationship, right?
Absolutely. That's why I was so geeked out to talk to you, Dr. Brown. I was like, I talk so much about sleep. I'm so geeked out to talk to a sleep expert.
I know, it's fascinating because when you try to unravel it, they're so interconnected. Because yes, when you don't have good sleep, one of the features of poor sleep could be, teeth grinding. If you're very tense, you might grind your teeth in while you're sleeping. You might also grind your teeth if you have an underlying sleep disorder like sleep apnea. That's the interesting thing. When you don't sleep well, you might wake up with a morning headache. You might also have a morning headache if you have a sleep disorder, maybe like sleep apnea, hypoventilation, some of these other disorders. And of course, you would feel irritable, you would catastrophize, you would, so the question is it the anxiety that's leading to the sleep issues that's then leading to the more of the anxiety, or is it the sleep problem, the fact that I couldn't sleep well for some reason or the other, now I'm more prone? And I would say yes to both. Really,
it's both. Hear this, Dr. Brown, like 50% of people with anxiety have some type of sleep problem. 50%. So the anxiety and sleep disorders co-occur a lot. And there's so much overlap between like the neurotransmitters that operate in the sleep wake arousal systems as well as the anxiety system. So they're the evil twins.
They are. And so then, when we're addressing this, when I'm seeing clients, when I'm seeing patients, and this is across the age spectrum, I'm seeing it in very young kids all the way to, moms and things like that, struggling with this. And sometimes, the healthcare system doesn't do them justice. Sometimes we're really trying to focus on the problem, right? And not necessarily trying to address the underlying root cause. And so what that might look like if they came to see me would be, I wonder, try to go to bed at a certain time, try to do this, try to, avoid drinking caffeine, try to have a good sleep, healthy sleep habits. But even when you create the sleep opportunity and you have untreated anxiety, then the ability or the capacity to actually get restful sleep will still be hampered. So this is where I think really trying to address the two at the same time as much as possible is key. So while we are promoting healthy sleep habits, while we're saying, yes, you need to, maintain consistency, have a routine, unwind, prioritize your sleep, all that stuff, then we have to look at what are the drivers, what are the stressors, what are the anxiety provoking situations, and how do you manage that? And I think that's where, this is where we all just have to work together, because I'm not a psychiatrist, right? I'm not a therapist. I can work on sleep. I can work on mindsets around sleep. I can work on stress reducing strategies at bedtime. But then if you're someone who's anxious, like, pretty much
All
all
the
the
time.
time, then we still have to address that. So
Absolutely.
what are some tips or strategies you would even offer to a mom who's like, listen, I feel like I could barely keep it together. People don't know I'm covering up a lot. I'm now exhausted. I've hit a wall. How do they manage that anxiety? Just from your standpoint, in terms of non-medicinal approaches and things like that.
To manage anxiety. So if we're going from a non-medicinal approach, one of the big things I find in professional women is that a lot of people's root cause of anxiety has to do with unrealistic expectations and desire for control. A lot of women will be the root of anxiety is expecting that they can work a full-time job and be a full-time mom and be a full-time car leader and be a full-time wife and be a full-time house cleaner and just have so much on the plate that they're in this constant state of hypervigilance because there's no rest. It's going from one thing to the other, to the other, to the other, with no planned time for rest and recuperation. Because whenever we're executing tasks, we're in an alert state. And so if we're in this perpetual alert state, our body learns to stay alert perpetually. And then our alarm systems are perpetually off. We train ourselves to be super anxious. And so we stay in this anxious state. And it's the chase sometimes for a lot of people, a lot of women, that are the underlying causes of anxiety. So I would say from that perspective, gaining control of our schedules, acknowledging what is humanly possible for us, and planning out things. As one of my favorite mentors will say, you can have everything, you cannot have it all at once. So prioritizing, I say for professional women, the conversation I have a lot is look at your schedule, see what you can prioritize, see what's reasonable, see what can wait, see what can be put later, and then plan time for rest and relaxation, right? Have some time planned in there where you can take a breather and really just rest. Not self-care for self-caring's sake, but self-caring for pausing and reflecting sake. Another common etiology for anxiety, or I don't know if etiology is the right word, but another source for it is the need to be in control. I need to have everything done exactly the way I like it at exactly the time I like. Forces a lot of professional women to push away help. And so again, you're left doing everything to perfection all by yourself. So relinquishing control, especially when it doesn't count. Doesn't really matter how someone puts on a diaper, as long as the diaper is put on. And this is just a very baby related example, but if as long as the diaper is on the baby, it shouldn't really matter. But we perfectionists, professional women, like it done a certain way, and we obsess about how things are done. So allowing ourselves to become mindful of where we can yield control so that we can have rest and be less worried, I would say would be two very broad approaches to non-pharmacological interventions for anxiety. In terms of real things we can do that are non-pharmacological, there are relaxation techniques. Is that kind of what you're thinking about, Dr. Brown?
Absolutely, yeah.
So my favorite and my personal favorite, and one I use a lot, is deep breathing, which is a process of becoming mindful of your breath, how you take it in, slowing it down. I like this a lot because it physiologically, when we do that, slows down our heart rate. And I've done this while hooked up to machines, so I know that when you take deep breaths very slowly, not hyperventilating, the deep breathing exercises can help us manage an anxious situation in the moment. You can slow your body down, regulate your physical self in the moment, and that's some way to regulate in the moment, control anxiety. Other forms could be body scan, where you're just being mindful of parts of your body a little bit at a time, but watching it. That can help us feel calm in the moment. And I think I've heard this also used in a sleep setting as well, when you're trying to go to sleep. But it's a way of calming, regulating your body. Guided
Mm.
imagery is another, as well as progressive muscle relaxation. I like that a lot as well. That can really put you to sleep, progressive muscle relaxation, and can
Yeah.
be very helpful in anxiety situations. There are also other kinds of counting techniques that people can
Mm.
Google. Lots of YouTube videos about this, by the way, for
Mm.
anyone listening who wants to kind of venture or explore out into these things. So those are some practices. I would say that these practices don't work well if you haven't practiced them. When
Mhm.
I tell people to do deep breathing, they try it like when they already are anxious or in a panic.
Yeah.
And of course it doesn't work because they're not practiced at doing it. So they end
Mm.
up hyperventilating and making the problem worse. So
Mm.
I say that if you plan to choose any of these methods, to look it up. There are lots of YouTube training videos on them, and you can practice, make it a daily practice. That way, if you're practiced at doing something, if you have to call it up, when you do it, it can feel natural. And it's not like you're trying to learn how to do it while you're panicking and you're anxious.
Mm.
So
Mhm.
those are some
Mm.
general ones.
I love that. Every single one of them is, it's hard to find my favorite. I think my favorite is also deep breathing and also progressive muscle relaxation. And really, it's about tensing and relaxing muscle groups. And what you said is so true. In the moment, you're extremely overwhelmed, e.g., or for example, you can't sleep and your mind is already racing about how dysfunctional you're going to be the next day, how you're going to make mistakes, how your children are going to say you're a bad mom. And you have all these thoughts. You're already in that anxious state. To now try to get breathing in so that you can sleep, it's a lot. It's a
It's a
lot
lot
to
to
ask
ask.
for. And so then there's something I call sleep related effort.
Mm.
I didn't coin that statement, but it's something we use in the sleep world where when you have either insomnia or you have difficulty sleeping, and then you start to try, you apply more effort in trying to sleep, sleep eludes you, it becomes harder. So when
Mm.
you start to take the breathing technique or the progressive muscle relaxation or the body scan, and you're trying to use it as work to sleep, then it doesn't work. And people say, I tried everything and it didn't work. But because of what you said, exactly what you said, if you make it, a habit, if you make it like a lifestyle, like practice during the day, so that when you are in that state at night, you're like, okay, I'll just do what I do when I feel a little bit overwhelmed. Then you're more likely to see the benefit. But when it's like, okay, how many breaths did I take? Come on, come on, come on, let's go, let's go. you know,
You're
you're like,
working.
come on, man, come on, let's do it, do it, do it. Then it becomes work. And sleep is not work. And so I just love how you talk about this. And I think more importantly, the fact that this is something you should use even during the day when you're in that stressful situation, when that child is refusing to put their shoes on and you're already running late and you're trying to get out the door. These are strategies you want to already have in place so that when you manage that stress and slow yourself down physiologically in that situation, then at nighttime, you're more likely to get the benefit from that. So I really love that.
Absolutely, absolutely. Thank you. Thank you. Like, yeah, sleep and anxiety is so
Yeah,
connected.
they are. They are. So one final thing I wanted us to just touch base on. So we talked a lot about things, and so you can see that there's a lot of tools in our toolkit, and you've not even stepped out the door, right? You've not even
Right,
stepped out the door. You've not even called a friend or someone
right.
that you can talk to, or a counselor
Yeah.
or a coach. These are things you can actually just start to do on your own
Yes.
today.
Yes.
But then what are some telltale signs or some symptoms that we need to be aware of to say, okay, you know what? It's time to see, Dr. Akinronbi, it's
Definitely.
time to see a therapist. It's time to really start to seek that professional help.
Um, I would say that if you've tried everything we've talked
Yeah,
about and
yeah,
finding that you're still struggling
yeah.
and it's persisting for a long time, right? Because
Mm,
when all of those things are persisting for a long time, you're irritable, you're lashing out at people, it starts to show up,
mm.
right? Your children may run in the room when you come home because you're like, oh, she's here, the dragon. Or your partner starts to complain that you're
Mm,
lashing out at them, you're yelling about small things, and it's different for you. So it starts to require a higher level of intervention. I'd even almost say it might be starting to be late then, but when you start to show
mm.
up at work, at home, in your relationships with your children, it's
Yeah.
definitely time to get professional help for it
Yes.
at that point in time.
Definitely. So you're already starting to see it impact your day, impact your function, impact your relationships. You're already starting to see that it's just harder for you to cope, or it's been going on for a while. Like, we do have times and seasons in our lives, right? You have seasons where things get stressful and then things calm down, then things get a little stressful. But then if you just feel like you're riding that perpetual high of stress for a while, and that is going to differ for everybody. So you yourself have to know that, like, okay, this seems to be a bit more than I can handle, then it's time to reach out for help. So this has been incredible. We didn't even go on to talk about medications, but I know those are definitely options.
Yes.
But I think my goal is to empower us women who are doing it all to really be kind to ourselves, to realize that we don't have to do it all, and then there's strategies to cope, to manage this anxiety, so that we can sleep better, so that we can think clearer, so that our mood can be better, and we can be better, we can better serve our generation. So, and you have provided this in such a very comprehensive way today, and I really do appreciate talking with you.
Thank you.
Now then, we are at that point where it's like, okay, this is a bit much, I need help. How do people find you? Because you are it.
Thank you. So I would say, first and foremost, our practice website is BrightMindsMD.com online, which is where people can schedule appointments with BrightMindsMD, myself or other doctors I work with. I'm also online socially on Instagram and TikTok as Dr._Bolanle. That's Dr._BOLANLE. And Facebook as well, where I post like short snippets of information about anxiety and other interesting mental health topics.
Awesome. Well, this has been incredible. Thank you for stopping by and talking with us. And I hope this has been helpful out there. If you're listening, if you need help, please reach out. If you're having issues with sleep, that's where I come in. I help you to debunk the myths around sleep, resolve the limiting beliefs, address strategies, or come up with strategies with you to help you to sleep better. And so the best way to reach me is through my website, restfulsleepmd.com/work with me, and we can make sleep a thing. So thank you again. I really appreciate you chatting with us. And until next time, I hope you all rest well.
Thank you. Thank you, Dr. Funke. Thank you.